Narcan, for instance, is not going to fix this problem. We need to have a comprehensive approach to how we deal with this on a community-wide level, so that includes education, prevention, and treatment.
The average life expectancy for Americans has plummeted for the second year in a row.
And according to the National Center for Health Statistics, the opioid epidemic is exactly the reason why. In 2017, just in Cuyahoga County alone, we have already surpassed last year's number of overdose deaths. And experts say the epidemic isn't slowing down anytime soon.
Nope. News 5 Amanda Van Allen wraps up this year's opioid crisis and tells us what the plans are for 2018.
Well, the problem right now is experts, community and family members are trying their best, but the numbers aren't showing any relief. More people are being killed each year by opioid overdoses, and more people are transitioning from opioids to street drugs like heroin and fentanyl. Experts haven't been able to figure out how to slow these trends down, but 2018 will be another year of more programs and trial and error.
So while our numbers are getting worse, so many people in our communities are dealing with this problem, I want people to walk away with a sense of hope. There are so many throughout our community that are really working hard to help individuals and patients.
One of the ways Emily Metz and her team are helping is through the Office of Opioid Safety at Metro Health System. It rolled out a few months ago, but the plan is to make it bigger in 2018, and she hopes to get to the root of the problem.
And through that, I mean safer prescribing for our patients. So we provide education, advocacy, and treatment for our system, and we want to extend that out into the communities.
Overdose deaths in Cuyahoga County as of the beginning of December are at 724. With nearly a month not accounted for yet, the county is already surpassing last year's numbers of 666 opioid-related deaths. But those are just the people killed from drug use. The amount of Cuyahoga County residents who misuse or abuse opioid prescriptions could fill First Energy Stadium, and those that transition to heroin could fill up the queue.
In 2015, so 2 years ago, we had about 50% of the children in foster care, primarily because of their parents' substance use.
Children are also falling victim to the crisis. Angela Saucer, the executive director of the Public Children's Services Association of Ohio, says in a few years, placement costs for children in foster care will increase by $176 million.
And if the opioid epidemic doesn't slow down, which there's no sign that it is going to slow down anytime soon, we will have in 3 years over 20,000 children in foster care on any given day.
Now, I also asked Emily Metz at Metro Health about any dangerous trends she sees coming in 2018. She told me users are transitioning now from fentanyl to carfentanil, which could be up to 2,500 times stronger than heroin.